Next, we have a special video message from Representative Michael Burgess. And I also would like to introduce Jacquelyn Incerto. She's the Legislative Director and Senior Health Policy Advisor from Representative Burgess' office.
Hello, this is Congressman Michael Burgess. I represent the 26th District of the state of Texas. I'm sorry that I'm unable to be with you in person, but I am grateful for this opportunity to speak to you all today. I would like to thank Sickle and the Sickle Cell Community Consortium for hosting this event and advocating on behalf of sickle cell disease policies and patients. I'm a senior member of the Energy and Commerce Health Subcommittee. I'm also the chairman of the Budget Committee Healthcare Task Force. So I want to tell you, I prioritize policies that focus on the needs of patients in the United States and aim to provide better access to affordable, quality health care in our communities. Throughout my time in Congress, I have championed several critical pieces of healthcare legislation for sickle cell patients. Last year, I, along with other members, Representative Danny Davis and Buddy Carter, I introduced a bill that will amend the Public Health Service Act to provide resources for blood disorder research, surveillance, prevention, and treatment for sickle cell disease. These programs will empower many families and sickle cell disease patients in the United States. One bill that I'm currently working on also benefits sickle cell disease patients. I introduced the Sickle Cell Disease Comprehensive Care Act, which would allow state Medicaid programs to provide comprehensive and coordinated care to patients with sickle cell disease through a health home model. During my residency at Parkland Hospital, and it was a long time ago, but I've cared for and have seen the devastating effects that this disease has on patients. So I understand the importance of having timely access to providers, care coordination, early intervention, and treatments to combat sickle cell disease before it is too late. These bills are just some out of the many that will help improve the lives of sickle cell disease patients. While I close out my last term in Congress, I will continue to advocate for sickle cell disease issues. I hope you have a great forum learning from each other and bringing much needed awareness on this devastating disease. Thank you. Hello, this is Congressman Michael Burgess.
Hi, everyone. My name is Jacquelyn Incerto, and I'm the Legislative Director for Dr. Burgess of Texas 26. I'm going to start with a little introduction about myself and my time with my boss, and then I will go into his history as an OBGYN for the North Dallas area and how he came to Congress and why sickle cell is really important to him. So I started my career here in 2018. I worked for Congressman Roscom of Illinois of the Ways and Means Committee. He was the Health Subcommittee Chairman at the time. I then moved on to work for Congresswoman Miller of West Virginia, focusing on a lot of Ways and Means health issues as well. However, we were not on the committee at the time. And an opportunity came up to work for Dr. Burgess, and I thought, I'm going to take it because he is such a health leader in Congress. And I've been with him for about 2.5 years. A little bit more about my boss. He sits on the Powerful Rules Committee, the Budget Committee, and the Energy and Commerce Committee, specifically on the Health Subcommittee. He was a former chairman of that subcommittee back in the day. We've done a lot of work in the sickle cell space for many reasons. I stated he was an OBGYN. During his residency in North Dallas, he practiced in the area mainly on sickle cell patients and patients on Medicaid. And it really enlightened his experience when he came to Congress and he realized that these patients need federal policy that best reflects care coordination, affordable medication, and preventative health services. So back in the day, we introduced a bill called the Sickle Cell Comprehensive Care Act. It would allow for 10 states to pursue forth for a Medicaid demo for care coordination and allow for, connecting individuals with sickle cell disease to a provider to then help manage their disease before it gets to a later stage, which isn't good for the population, and it's certainly not good for healthcare savings either. Recently, in the Energy and Commerce Committee, I have an exciting announcement. We introduced a bill with the same name. And the concept of the bill would be to implement a health home model for patients with sickle cell disease. The reason why we went forth with this model is because it would be a cost-effective way to get at the goals of our first bill, the Medicaid demo, and accomplish care coordination and better care for individuals with sickle cell disease. They brought it up in a hearing at the committee, and my boss talked about it, and we would really like your support. It's HR 7432. That is the Sickle Cell Disease Comprehensive Care Act, and that was just reintroduced as a new bill this year. We've done a lot of work in the past with Congressman Danny Davis of Illinois. We've led sickle cell disease resolutions. We led our original Medicaid demonstration project bill, and we're also co-leading with them the health home model bill as well. So I'll go into a bit more detail on how the health home model works. Basically, states would be able to use a state plan amendment option financing for care coordination for individuals with sickle cell disease. So connecting them to a provider, a social worker, a care coordinator to be able to better manage their condition, again, before it gets to the stage in which it becomes out of hand or unmanageable. We've seen a lot of these patients, particularly on Medicaid, go to the ER or have trouble managing their conditions because they don't have access to a provider. And we see this as something that Congress needs to take up immediately because it is a preventative healthcare issue as well. Recently, I will also mention that there was a bill introduced by my boss, the Preventative Health Savings Act, which would allow CBO to look outside the 10-year budget window to take into account preventative healthcare savings for federal health policy legislation. I think it would be beneficial to advocate for this bill as well, because as it relates to sickle cell disease and some of the other bills that we have led previously, the Congressional Budget Office should be taking into account how providing care coordination services for these individuals can attribute to federal healthcare policy savings, dependent on the situation. But it's a very exciting time. We have had a long history of working with Mr. Davis, and recently Mr. Carter has been engaged on sickle cell issues as well. Again, the name of the bill is the Sickle Cell Disease Comprehensive Care Act, and it was introduced recently, and the number is 7432. And we hope that we can get your support on that critical piece of legislation as you continue to have conversations around the Hill. Thank you.
Thank you so much, Jacquelyn, for that presentation and all the work that you're doing in the office and for sickle cell disease. So I'm just looking if there's anyone from the audience have any questions. My one question is, would you be able to touch on a little bit about the reauthorization of the HRSA program?
Oh, yes, certainly. It's funny with panels, I always forget, a bill that Dr. Burgess has led on because it's been so many years and there's been so many bills in the sickle cell disease space. This past year, we led a reauthorization through HRSA on sickle cell disease data and research analysis. So basically, it would provide for additional funding for HRSA to take up looking into data collection on the issues that we're seeing in the sickle cell populations. Why is that important? Because it informs providers on how care management should be taken up. And it also helps the general public know where are we seeing issues in the space and how can we better improve outcomes later down the road using this data. The bill we hope is going to be taken up as a suspension in the next couple of months. We've had a lot of our public health reauthorizations put up on the floor as of recent, and we would really like to see it move forward. It is also bipartisan and bicameral. So by any means, if anyone can reach out to their senators as well, advocating for the bill, that would be extremely helpful, because if we move it on the House side, of course, it has to be taken up on the Senate side as well. But again, the collection of data is beyond important for our healthcare providers and for the general public to know how we can use it to better improve outcomes for our patients with sickle cell disease.
Awesome. Thank you so much. So the audience, please feel free to put any questions. Let's see. So we have one question from the audience. How does the HRSA data collection differ from the CDC's data collection program?
So HRSA is a different part of the administration, but you are still accomplishing the same goals within data collection. I would say HRSA is specifically looking at healthcare outcomes in relation to care coordination and how we can use that for providers and the general public. The CDC is a little bit more broad in data collection on sickle cell disease. So, you're looking more in depth into that data set. So I would say they're similar but different. HRSA is a little bit more specific as it relates to public health outcomes, and the CDC data collection is a little bit more broad.
And for the audience, we also have a further discussion on the CDC data collection program as well for today. We have another question. Can you clarify, what does suspension mean?
Sure. So suspensions we often put on the floor at the beginning of the week. They are non-controversial bills that often have bipartisan support and don't take a lot of debate back and forth. Although it prompts for some. So it really means it's an uncontroversial bill that is put up and it's easy to move across the House floor. And it does not have to go under through the Rules Committee, which my boss sits on as well. That's an important clarification.
All right. I think that's it for questions. Thank you so much again for coming to this event and just speaking to us about sickle cell. And also, we just want to thank Dr. Burgess, Representative Burgess, for his commitment to sickle cell for all these years, being big champions. And I know the community is going to miss him.
No, absolutely. I really appreciate the invitation to be here. And it's been such an honor working for him as a member. He's very passionate about what he works on, and that's why we have a lot of laws on the wall here. So, on behalf of him, thank you for having me. Thank you for including him in the conversation. And I will make one more point on 7432. I think this bill is a good way to hit at the goals of the original Medicaid demonstration project. That's why we gave it the same name as the bill. And I think it will be easier to move with the fiscal constraints that we are under, given the fact that he's on the Budget and the Rules Committee, and anything that passes the House has to have an offset. This is a good meet in the middle for patients with sickle cell disease. And, look, if we can get this done this year or in the future, and it originates with my boss's name on it, then it's a win for sickle cell patients. And my boss and I would really appreciate everyone's support in advocating for this bill. So thank you for having me, and thank you on behalf of Dr. Burgess. And I hope you all enjoy the rest of the forum.